So there are two sides of the procedure. Now the hair transplantation is done. This is post-operative notes. Two sides of the page, side A and side B. Side A, इसमें क्या है? Whatever we have done, everything is mentioned in this. And side B is what you are supposed to follow at home. So these are the tablets that I have already sent you on WhatsApp. So these are the medications that you will be taking. Out of these tablets, Pandy is to be taken one in the morning and one at night before food for 5 days. Rest 2, 3, 4 and 5. These 4 tablets you are supposed to take one in the morning, one at night after food for 5 days. What all these tablets are for? Pandy is to reduce the gastritis. That's why you will be taking 15 minutes before food. And rest tablets, one is an antibiotic, one is an anti-inflammatory, one is to reduce the swelling and another one is to reduce the pain. So these 4 things you are taking, one in the morning, one at night after food. Today you will be having after lunch and again after dinner. From tomorrow you will be doing in the morning and night. Okay. Regarding these things, I'll tell you now. Now, donor area, the backside from where the follicles has been extracted, we call it as donor area. Now, tomorrow morning, you will remove the bandage at home and take Johnson's baby shampoo and wash the backside gently with the shampoo. After washing that, clean it with a clean towel. Wipe it with a clean towel and apply this ointment, tea-bagged. This you are doing once in the morning, once at night. Okay, so tomorrow morning, remove the bandage, wash it with the shampoo and then apply the ointment.
So I have to wash each of the time?
Morning you wash and apply the ointment. Night time, just apply the ointment, that is sufficient. Like that, you will be doing for the next 7 days. So once you remove the bandage tomorrow, no need to put the bandage again. Bandage is only for the next 24 hours. Since we have used 0.8 or 0.9 millimeters punch, the follicle, the punch size is very small so that the wounds will heal very fast. Okay, this is the donor area. Second thing, the front side where the follicles has been implanted, that is called as the recipient area. I'll be giving you a normal saline bottle and a spray. So you are supposed to spray onto the front part where the implantation has been done once in every 30 minutes. Now, tonight you will sleep for 8 hours. So do you have to wake up and spray? No, not required. Whenever you are awake, you are supposed to spray once in every 30 minutes. Okay. If you wake up at night time to go to washroom or drink water, consider spraying it once and again go to bed. So exactly it has to be not 30 minutes. It's okay. Chalta. 30 to 45 minutes is okay. Fine. You can be little lenient with that. Having said that, only normal saline should come in contact with the front part. No other water should come in contact for the initial 1 week. This is also for 1 week duration. Third thing, sleeping posture. Now see, the follicles we have implanted at the sides, front and the sides. If you sleep sideways, the follicle will come in contact with the pillow and all the follicles will come out. Whatever we have done, everything is waste. So at night time when you are sleeping, you are supposed to use that horseshoe pillow, keep it on the neck and then sleep in a supine position, means straight. So what will happen, even if you want to turn your head, the sides of the pillow will restrict the mobility so that you can sleep comfortably.
Like the contact of head with
exactly.
Circles.
Yes, it will protect from this coming in contact with anything. Now you might be thinking, what about this part? Is it okay if this comes in contact with the pillow? Absolutely fine. Imagine there is a tiny cut on your finger. What will you do immediately? You hold it and press it for a while. By doing that, the bleeding will stop and clotting will happen. The same thing with respect to the donor area. Donor area, if it is pressed, it is good. But recipient area should not be touched for the next 1 week duration. No tea, coffee, beverages today. From tomorrow you can have. No smoking, alcohol, green tea for 2 weeks. If it is not there, great. If you are going to stop it forever, that's excellent. Wear surgical cap for a week duration. Now, this is a surgical cap. Why do you have to wear a surgical cap? Is to protect from dust and any sort of insect sitting on the follicles. Again, this is not sunlight proof. So wearing this cap and going to sunlight will not help. So you're supposed to stay indoors for next 5 to 7 days and you will be wearing the cap whenever there is a dust exposure. So now that you go home, you don't have to continuously keep on wearing it because you will be spraying once in every 30 minutes. Wearing it, putting it, it might be a little irritating for you. So stay in a dust-free environment. If you are obligated to go somewhere outside, then you have to wear it and go. If you are not going anywhere outside, better. Once you go home, just remove it and keep it aside. So how do you wear it? You are supposed to cut the cap front side and back side and make it little loose and just place it on the top. That's it. Right? So once you go home, just gently remove it off and keep it aside. Don't go anywhere outside for next 5 days. If you have to travel, then you have to wear it and travel. Right? So you can wear cricket cap or skull cap after 1 week duration. Okay. So no helmet for 1 month. No exposure to sunlight and dust for 1 month. See, 1 week anyways you are not going outside. After 1 week, whenever you're going outside, you will wear a cricket cap or a skull cap. By doing that, you are protecting yourself from the sunlight and dust. Anyways, after 1 month, it's okay. Even if you get exposed, it's absolutely fine. Eat soft and bland food for the first 3 days. Because the follicles that are implanted here, and when you chew, there is a small movement that's happening in the temporalis muscle, this particular part, that can gently push the follicles outside. It will not completely come out, but it will come out of the, so that can make look like, cobblestone appearance. So to avoid that, eat something which is soft to chew, and don't eat a spicy thing, because you are already taking so many tablets, and again eating spicy things might cause gastritis. No yoga, gym, cardio, sports for 1 month, because doing these kind of activities will increase the sweat, increase the chances of infections and all those things. So better avoid it for 3 to 4 weeks. No swimming for 2 months, because water is usually chlorinated, better to avoid. Massage forehead as advised. Now, this is when the follicles we are implanting at the front, and we would have injected little normal saline. The chances of that fluid coming on the forehead is always there. So how do you avoid that is, index finger and middle finger of both the hands, keep it in the center and gently massage like this. So you start doing this from tomorrow morning. Stand in front of a mirror and do it. Why in front of a mirror? Because accidentally we don't want you to take your fingers on the follicle and just spoil everything. So stand in front of the mirror and gently do this. Every morning 10 times, afternoon 10 times, evening 10 times, and night 10 times. So massage so that whatever the swelling that is going to happen will get dissolved. Last thing, now when you're booking a cab and going home, make sure you completely bend your head and sit properly in the cab. Lot of people will be unaware of, because the head is heavy and anesthesia is, exactly, they bump their head onto the car rim and all the follicles will come out. So be very, very, very careful regarding this particular thing. So follow all the medications and take all the medications, follow all the instructions as I have mentioned here. After 1 week, you don't have to come. You can just send me the photograph onto this particular number. I'll have a look and then I'll tell you what is to be done. Means how to wash and all those things. I'll guide you over phone itself. Okay.